Well, I say I'm not really the caregiver at this point since she's in a nursing home, but the challenge is dealing with the fact that she is in a nursing home, that I can't really take care of her, that she needs constant stimulation. She needs people to walk her constantly. She needs the activities. That's my challenge, is to be at the nursing home frequently and make sure they're doing what they're supposed to be doing. Making sure that if I walk in and she's sitting in a chair and there's an activity going on, and I'll say, why isn't Mom at an activity? And they'll say, well, she said no. And I said, you don't ask Mom. Because at this point, especially in her state, her immediate answer to anything is no. I said, you have to use some psychology, and you have to tell her that you're going for a walk, that you're going to meet somebody, that you're going to hear a wonderful music presentation, but giving her the choice, she still wants some autonomy, and I think her autonomy, those answers of no, are her way of having some kind of control that she no longer has. So it's just kind of my role, I think, is making sure that she is still stimulated, that she is that she is well cared for in terms of her her hygiene and all of the rest. As I said, I've watched, one of the sad things I've watched, and this bothers me every time I go, is as we moved her from her house to the condo, to the assisted living, now to this one room, that I feel like I've divested her of everything, that she, her world has just become so small. And the one thing that my siblings and I agreed to leave with her was her engagement ring and her wedding ring and an anniversary ring that my dad had given her. They were very snug on her hand, and they gave her pleasure. And I would talk about them every time we went. I'd say, have your rings on, Mom? And she'd look at them, and I'd say, who gave you those? And she'd remember. She'd say, Bill, it's my dad. And then we'd look at them, count them, talk about them. And then 2 weeks ago, I went, and the rings are gone. And I was just devastated. And again, the nursing home has no liability for something like this. You don't know how they disappeared, or what, and in these economic times, who knows what happened to them. But there's not the monetary value attached to them. It's that they were engraved, they were from my dad, and that they were the one thing she had left that sort of kept her in some sort of, relationship with my father. And they're gone. And I was just devastated.